We will talk about anemia and most common causes of anemia. It affects around 25% of world population. It's very high number. It means it's very common condition. And how we define anemia. Anemia is when we have no enough healthy red blood cells. What are the most common symptoms of anemia? It's tiredness, fatigue, lightheadedness. They are not specific for anemia, but they are very sensitive to anemia. If we have severe anemia, we almost always have tiredness, fatigue, and lightheadedness in many cases. And there is 3 main mechanisms how anemia can be developed. First is decreased number of red blood cells. So first is if we have reduced numbers of red blood cells, we have anemia. Second is reduction in hemoglobin. So we may have enough red blood cells, but we have lack of hemoglobin, and it also anemia. And diminished capacity of the blood to carry oxygen is also anemia. When red blood cells have diminished capacity to carry oxygen, which is main function of red blood cells, to carry oxygen and oxygenate our tissues. Let's say what is most common cause of anemia is iron deficiency anemia. When we have iron deficiency, we have anemia. It's responsible in 50% of cases of anemia. It's very common condition, especially reproductive age women. During menstruation, women loses blood and they lose iron, and that's why many of women is under iron deficiency and eventually iron deficiency anemia. Symptoms of iron deficiency anemia is fatigue and weakness, pale or yellowish skin, shortness of breath, headache, cold hands and feet. And how we can detect iron deficiency anemia in laboratory? We have low level of hemoglobin. It's very important definitive. Also low hematocrit in the blood. Microcytosis. It means we have smaller red blood cells. Smaller compared to normal. It is called microcytic anemia because we have smaller red blood cells. It is called microcytosis. And reduced serum iron and ferritin levels and increased total iron binding capacity. Increased iron capacity because we have less iron and iron binding capacity is increased. Treatment, of course, it depends on cause. For example, if person loses lots of blood, he or she needs blood transfusion. But if there is iron deficiency anemia from menstruation, for example, then iron supplementation is enough as a rule. We have second most common cause of anemia is vitamin deficiency anemia. It's responsible around 20% of cases. So if we say person has anemia, 50% probability is iron deficiency anemia and 20% probability is vitamin deficiency anemia. And when we say vitamin deficiency, we usually mean vitamin B12 deficiency and sometimes folic acid deficiency. And especially vitamin B12 deficiency is common among vegetarians and vegans who don't eat animal products, because vitamin B12 is in animal foods, in beef, for example, and eggs. And if person don't eat animal products, then there is high probability of vitamin B12 deficiency. What is different symptoms and what is how can we differentiate, for example, vitamin B12 deficiency from iron deficiency anemia? With symptoms, here we have neurological symptoms also, like numbness or tingling in the hands and feet, memory loss, cognitive difficulties, visual disturbances, glossitis, or mouth ulcers. So in case of vitamin B12 deficiency anemia, we have neurological symptoms also, and of course we have tiredness, fatigue, and pale or yellow skin. That's classical symptoms of anemia, and plus neurological symptoms. In laboratory we have macrocytic anemia. In iron deficiency anemia we have microcytic anemia. Here we have macrocytic anemia. Macrocytic means that these red blood cells are bigger and larger compared to normal. In case of iron deficiency we had smaller than normal. Here we have larger than normal. So if we have larger cells, larger red blood cells, it means vitamin B12 deficiency, or folic acid deficiency, or vitamin deficiency anemia. And we have specific form of vitamin B12 deficiency anemia, which is called pernicious anemia. And what means pernicious anemia? It means autoimmune disorder when our body attacks our gastric cells, which produce intrinsic factor, and this intrinsic factor is protein which is needed to absorb vitamin B12. So even person intakes enough vitamin B12, he or she cannot absorb it because no specific protein which is needed for absorption of this vitamin. That's why treatment at this case is lifelong injections of vitamin B12, for example once a month. If left untreated this condition, we will have serious complications like nervous system damage and heart damage. Another cause of anemia is anemia caused by chronic conditions. It's responsible around 15% of cases. It means, for example, when person has cancer or inflammatory disorders or HIV, then he or she will have also anemia at some stage of his or her disease. But such cases is not very common, and it's responsible only 15% of cases. And also it's important because this anemia is not main complaint of this patient, because this patient already have serious disease, and this anemia is secondary. And hemolytic anemia is responsible on 5% of cases, and there is elevated reticulocytes. Hemolytic anemia means when there is breakdown of red blood cells. If hemolytic anemia is severe, we need blood transfusion. And aplastic anemia is also a rare form of anemia, and at these cases there is not only anemia but also reduction in all type of blood cells, including white blood cells and platelets, and it is called pancytopenia. Now to summarize, most common cause of anemia is iron deficiency anemia, especially in young people. Some cases, if person is vegetarian, we should think about vitamin B12 anemia. Some cases, if person has serious illnesses, it can be chronic disease, and chronic disease caused anemia. And sometimes it can be hemolytic anemia, sometimes aplastic anemia, but such cases are rare. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.